Marine Life Hazards and the Management of Injuries by Dr. Frans Cronje. Marine animals hold both a fascination and a potential danger to mankind. Although these injuries are fortunately fairly rare, they can affect us in important and unexpected ways. In spite of a remarkable diversity of animals and creatures and plant life, there are actually 4 core ways in which hazardous marine life may affect our health. These include injury, allergy, toxicity, and infection. And each of these categories may exert both primary and secondary effects. And so it reduces the complexity of devising strategies into those 4 components, broken into the primary effects being overcome and the secondary effects being prevented as far as possible. Now, allergies, to start with, are quite common related to marine material and are similar to what we would experience on land. In other words, through contact, injection, ingestion, or even inhalation, there may be a sensitivity response ranging from rash to anaphylactic shock. But on top of this, there's the additional complication of being within a hostile environment, water. In other words, severe anaphylactic reactions are likely to result in drowning. On the toxicity side, many marine organisms are indeed toxic, and the type of toxicity is defined primarily by the way it enters the body. In other words, ingested noxious substances are called poisons, whereas those substances that are either injected by fangs or spines or transferred upon contact we call venoms. In the final part of this presentation, we will consider the various poisons, but for now, let's focus on the generic aspects of venoms. Venoms exert their harmful effects through a myriad of protein-destroying and biochemically disruptive events, and these include cell membrane disruption and destruction, loss of important messenger molecules, release of histamine and allergy, inflammatory reactions, clotting abnormalities, disruption of cellular transport of proteins and electrical currents, including nerve cell transmission, and finally anaphylaxis and, of course, shock. The nervous system is particularly sensitive to these types of disturbance, and it may be affected in somewhat illogical or unpredictable ways. It's therefore useful to remember that the automatic functions of the body are governed by the autonomic nervous system. These systems, made up of the parasympathetic system, which I like to call squeeze and ooze, versus the fight or flight system, the sympathetic system, which I like to think of as pucker and panic, may both be affected. But not only that, there may be overreactions and paradoxical reactions on both sides of the autonomic system simultaneously. So therefore it is possible, through the derangements of venoms, to, for instance, suffer from hypertension and bronchospasm at the same time. The way in which venoms disrupt the nervous system is quite sophisticated. It should be remembered from a strategic point of view that many of the creatures that hunt are actually slower moving than their prey. For that reason, many of the strategies of venoms are to paralyze the prey. The most common effects are related to disruption of sodium channel function or the interference with release, action, or degradation of acetylcholine in the neuromuscular junction. Many people don't realize the infective potential of the marine environment. It is literally crawling with bacteria. And while there are indeed certain unique organisms restricted to the marine environment, many have familiar terrestrial counterparts, or may occur in both environments, like Clostridium tetani. Here are some examples of the types of organisms that might be encountered underwater. Those labeled with asterisks are encountered both on Earth and underwater. Due to a need for thick cellular membranes to maintain osmotic balance in the high salinity of the marine environment, many organisms also have a natural resistance to penetration by antibiotics. So if infections do indeed occur, this resistance may impact the prognosis and also the choice of antibiotics, which must typically be broad spectrum. Most bacteria are gram-negative rods. Also, when attempting to culture these organisms, a high salinity is required in the culture medium. This is why frequently culture of these organisms may prove negative unless special measures are taken. Now, the propensity of these organisms to cause infection depends on how much of them are brought in contact with a compromised barrier, for instance, by means of an abrasion or laceration, as well as the pathogenicity of the organism, in other words, how nasty the organism is. And lastly, most importantly, the immune defenses of the host. Normal hosts are usually not in need of antibiotics for minor injuries, but if there are distinct vulnerabilities, a variety of antibiotics should be considered depending on the type and the extent of injury. For serious injuries, broad-spectrum antibiotics are required, and in high doses. For inpatients, these should include some of the big guns, while quinolones, for instance Cipro or Ciprobay, are adequate for outpatient situations. There are two infections that justify specific mention. One because it is particularly malignant, and the other because it is quite common and readily treatable. The first, a relatively malignant Vibrio infection, is associated with Vibrio parahemolyticus or vulnificus, that is in fact related to the cholera bacillus. It spreads quickly and results in a very, very aggressive hemolyzing condition. It is in need of very aggressive treatment. Another infection is caused by small punctures or contamination of cracks with organisms that colonize the surface of fish. It causes a typical red or cellulitis type infection, and it's called fish handler's disease. It responds to simple antibiotics. If you remember only one slide of this lecture, this is it. This is the roadmap to simplify an otherwise very detailed and perhaps confusing list of actions for each type of injury. So it's useful to remember this standard set of principles that is followed throughout. The first priority is life support, ABCs. Then, whenever possible, the cause of the injury should be removed, and this may range from removing the person from the water to rinsing the skin. The specific treatment in each case depends on the mechanism of injury. Is it an injury, an allergy, toxicity, or infection? Finally, complications should be reduced or prevented by cleaning and decontaminating wounds, and by removing foreign material and dead tissue. X-rays are always recommended, or ultrasound, for penetrating injuries. Even small pieces of spines or marine animal tissue that remain in the body may result in protracted, festering wounds with prolonged pain and suffering. The appropriate use of anti-infectives must also be considered depending on the wound and the person suffering from it, and that also includes tetanus toxoid, even for minor abrasions and injections. Now let's look at the perps, the bad actors, the troublemakers. Hazardous marine life can conveniently be divided into 6 groups. Firstly, the snappers that bite or tear. Then the stingers, who have specialized stinging cells that deliver venom into the skin. Next, stickers that have barbs or spines that introduce venom through the skin. Then follows the scrapers that abrade or irritate the skin. Next, shockers that deliver an electrochemical shock. And finally, well, I love mnemonics, snackers, the ones that are poisonous upon ingestion. In the category of snappers, there are many examples of marine animals that pose a threat to man: sharks, barracuda, crocodiles, moray eels, sea lions, killer whales, and so on. And they all fall within the phylum Chordata, which then includes all vertebrates, which is obvious since in order to have significant teeth, you also need to have a skull and spinal cord. So all of these fish, mammals, and reptiles belong to this phylum. Sharks, although perhaps the most notorious, are overemphasized as far as being a menace to humans. In fact, lightning strikes are 17 times more common. And as far as the greatest risk associated with teeth, it's actually boats and boating injuries. Every year, many divers are struck and injured or killed by boats, and the injuries they inflict are every bit as dangerous and severe as shark bites. Only 32 out of some 350 species of shark are actually dangerous to humans. As a group, sharks range in size from 5 inches to 48 feet, from less than a pound to 35 tons, and every year between 50 and 100 people are bitten by sharks. 5 to 10 of them die every year as a result. When it comes to statistics, the most dangerous are of course the great white, the mako, the bull shark, the dusky shark, hammerhead, and grey reef sharks. Clearly, the great white is undoubtedly the most dangerous to man. Its size, the natural predilection for marine mammals, and its prevalence in popular surfing, swimming and diving areas adds substance to this reputation. It occurs mostly in colder waters of the west and northeastern coast of America, southern Australia and South Africa. This is a video clip depicting a breaching of a great white shark in the process of capturing a seal. The power of the creature is obvious. Many of the attacks on humans are actually a case of mistaken identity. However, the power and the thrust of the initial exploratory attack may be such that survival is unfortunately not guaranteed. Sharks are able to inflict massive and often fatal tissue loss. Hemorrhage, shock, and death are common complications, and there is of course a very high risk of infection. Depending on the site of the wound, the victim may either die immediately or be incapacitated, bleed to death, or drown. It's relatively rare for sharks to have the opportunity to truly finish off their human prey. Statistics also favor rescuers as not being subject to attack, although it's wise to attempt rescue from a boat if possible. One bold spear fisherman in South Africa actually used the elastics of his spear gun as a tourniquet after being bitten on the calf, and that allowed him to swim to safety without dying from hypovolemic shock. The principle of shark bite care is fairly obvious. Firstly, the person needs to be kept alive by stopping the bleeding by whatever means one has. Then it has to be managed surgically and scrupulously cleaned, including X-ray guided removal of tooth remnants, which are very common, frequently impaled in bone. Then the wounds need to be managed and reconstructed, decontaminated, and broad-spectrum antibiotics and tetanus toxoid applied. Next on the list are the barracudas. Now, they're carnivorous, fast-swimming fish, and they're greatly feared in some parts of the world. They can grow up to 7 feet long and may travel in schools or alone. They occur along the tropical belts of America and Australia, and their dog-like mouth and tendency to stalk prey adds to their ability to intimidate. Now, actual attacks are quite rare, and they're usually associated with capture or spearing of fish and the barracuda themselves. One fatality occurred off Key West when an airline pilot was wearing fluorescent swimming trunks and was slashed in the groin by a barracuda and eventually bled to death en route to the hospital. Shiny or bright objects are known to attract the fish and should be avoided. Night diving also brings the greatest potential risk, with torches flashing all over the place, both attracting and confusing the fish. The management of bites is similar to shark bites. This shows the spear-like teeth able to pierce and hold on to their prey. Reptiles may also affect Homo scubiensis. The combination of size and undiscriminating eating habits makes them dangerous. Crocodiles have a narrower snout than alligators do and also have a visible fourth tooth. My advice is, though, to leave the taxonomy issues until you've left the immediate area. Also, alligators are only found in China and southeastern USA. As can be seen, the saltwater crocodiles and Nile crocodiles can become 10 meters in length. There's no doubt that crocodiles and alligators are dangerous to man. They're very territorial, have developed a social structure and even communicate underwater. They're protective of their brood and their harem. And combine that with 33 feet of length, 1 ton of weight and enough brain to stalk your prey, and you've got a formidable predator. Some years ago, probably an urban legend, but a golfer disappeared in the Everglades only to be found inside a crocodile. Well, whether true or not, it's patently clear that crocodiles can and do eat people. Crocodiles, compared to alligators, have the worst reputation. Alligators are typically more docile and slower moving, whereas crocodiles can sprint faster than most humans and attack even when unprovoked. They may growl in warning, but once they attack, they are quite persistent. Throwing objects at them or hitting the snout and gouging the eyes may abort an attack. Clearly, the solution is avoiding contact. Beware of walking near riverbanks or areas where there are posted warnings, known problems. Avoid tropical waterways and estuaries. Don't camp or fish from banks where there are known to be crocodiles around. And just don't be plain stupid. As can be seen in the video, the rolling action of the crocodile is designed to tear off tissue and also, in many cases, to drown the prey. The practice of feeding fish not only leads to occasional attacks by the culprits we've mentioned, but in fact from other predatory fish as well, and it's not recommended. Moray eels are beautiful and docile creatures. Their fearsome reputation is a function of their appearance rather than their actual habits. Nevertheless, they do have some equipment one should know of. In fact, they have two sets of jaws. Hidden at the back of the pharynx is a second set of teeth. This allows the eel to gain a better grip on its prey by holding on while the front teeth adjust their grip. Once the rear teeth have engaged, they are locked, and therefore one would have to actually decapitate the eel in order to release someone from the bite. Morays occur in tropical and temperate water and are popular with divers. Some become very tame when divers feed them, but there is a danger that they may become aggressive when the expectations are not met. They may then attack when provoked, and the nature of their teeth and the power of their jaws allows them to grab onto their prey. Rapid withdrawal of the limb results in lacerations. Moray eels are not really considered venomous, but wounds should be cleaned meticulously and examined for retained teeth. Similar to dog bite wounds, they should not be sutured. Tetanus toxoid and prophylactic antibiotics are recommended, and with hand injuries, examination of the neurovascular bundle. Sea lions and walruses are usually mild-mannered creatures, except during the breeding season. During this time, biting and cutting injuries may occur. No attacks have been recorded in the water on scuba divers, but they can occur, and the bites would pose a high risk of infection. Getting to the next category of stingers, we need to consider the invertebrates, and these pose the greater risk to man than vertebrates do. In this category, we will consider the coelenterate, sponges, worms, and fire coral. Most of the venomous invertebrates are contained in the phylum Cnidaria, which means stinging cells. The coelenterates consist of 9,000 distinct species, of which about 100 are dangerous to man. Although some resemble flowers, they are all carnivores who kill their prey with complex and potent venoms. The business end of a coelenterate is the nematocyst, the stinging cell. This cell contains venom-filled devices, typically consisting of inverted tubes, and there are literally millions of these stinging cells near the mouth of the respective organisms. And when the cells are triggered, either by contact or exposure to low osmolarity fluid, like fresh water, then the cells swell up and the dart penetrates. If it's in contact with skin, it goes through the dermis and may deliver the venom directly into the subdermal capillaries. This is a close-up view of a nematocyst showing the firing mechanism, and here is an animation showing how it works.
The tentacles are covered with millions of microscopic stinging capsules called nematocysts that are triggered the instant they're touched. Each capsule fires a tube that penetrates flesh, releasing the deadly venom from the sides, and it all happens at lightning speed.
This video clip is of a progressive firing of a colony of nematocysts of a Portuguese man-of-war. This is the type of response that may occur when these creatures are exposed to fresh water. This is what the thread looks like once they have been discharged. Upon penetration by a nematocyst, the immediate response is pain, vasoconstriction, histamine release, and tissue necrosis. The venom is a Pandora's box of agents causing multiple assaults on human biology. The symptoms are associated with contact dermatitis, burning, itching, and occasionally anaphylaxis. Here you can see a scanning EM micrograph with undischarged nematocysts. The image shows the discharge of nematocysts upon contact with methylated spirits, and this has served as a discouragement to use either alcohol or spirits as a first-line treatment in jellyfish stings. Finally, you see the appearance of tentacles after contact with household vinegar. The tentacles are actually shriveled up and undischarged, so this is what has led to the recommendation to to using vinegar as a first-line treatment for life-threatening jellyfish stings. As a general approach to nematocyst stings, the following principles apply. Firstly, avoid the release of further cells by rinsing them off of the victim using seawater or hypertonic saline. Never use fresh water, as this will discharge them. Even urine is better than fresh water. Once the majority of nematocysts on the victim have been removed, the remaining cells must be neutralized using vinegar. Tannic acid spray also seems to be effective, especially for sea lice. Now, usually the use of alcohol, papain, meat tenderizer, and pineapple juice are considered unproven or even harmful as primary treatments, but I've encountered certain situations where the locals are aware of a particular remedy for a particular sting. Avoid being arrogant, as I have been, which led to the discovery of tannic acid, by the way, and consider it objectively. For the most part, though, vinegar or hypertonic saline are the best solutions for irrigation. Once there are wounds, these should be cleaned, and one should remember that tetanus may follow as a complication even if it's a jellyfish sting. Antihistamines may be helpful, and the most effective topical analgesic is emlacrine. Topical steroids may limit delayed hypersensitivity in some cases, and if necrotic skin lesions develop, antibiotics may be required. Systemic support is very important, especially if there is significant toxicity or anaphylaxis, which may result in cardiovascular collapse. Hydroids, although they resemble fern leaves, are animals with stinging cells. The nematocysts don't generally penetrate the thick skin of the palm or soles, but they can be transferred and detached from the organism by gloves and then moved to more tender or delicate skin like that of the face. This results in immediate burning, itching, and inflammation. A delayed reaction may follow with papules that can take weeks to resolve. Regional lymph glands become achy, and as far as treatment is concerned, prevention is better than cure. In areas, for instance wrecks, that are littered with hydroids, it's wise that dive operators tell the divers to wear gloves and recommend that they discard them into a bucket of fresh water immediately upon surfacing. In this case, the stinging cells in contact with a glove would be harmlessly discharged and destroy in the fresh water. But never use fresh water when stinging cells are attached to human skin. If nematocysts are already on the skin, they need to be rinsed off with seawater, 3 times normal saline, or vinegar. Residual inflammation can be treated with topical cortisone. Fire coral envenomation is known to many divers. Immediately upon contact, there is a mild stinging to intense burning that usually builds up over 30 to 60 minutes and then gradually subsides over 24 hours. There is typically skin discoloration with aching lymph glands added to the clinical picture. Unless the original envenomation is effectively cleaned and even scrubbed, there sometimes develops a 2-week cycle of recurring symptoms. This appears to be due to some residual protein being absorbed by the lymph vessels as soon as the swelling subsides, and it starts the vicious cycle all over again. The treatment is very similar to other nematocyst envenomations, as you can see. Perhaps one of the most common culprits is the Portuguese man-of-war, Phasalia. Many people are allergic to Phasalia toxin. It's a neurotoxin about 20 times more potent than cobra venom. Fortunately, only a small amount is injected. The symptoms are immediate and are pain, often with visible tentacle prints. As with other jellyfish envenomations, there may be a gastroenteric complex of nausea, vomiting, diarrhea, and abdominal pain, sometimes even combined with fever. And of course, bearing in mind the tropical and remote locations, this could pose a diagnostic dilemma ranging from gastroenteritis to malaria. However, with jellyfish stings, there is either the history of stinging or telltale lesions. Severe envenomations can cause mononeuritis, seizures, hemolysis, bronchospasm, cardiovascular abnormalities, and respiratory depression. These blue bottles are fascinating on the beach, especially to beachcombing children. The nematocysts can actually remain viable for weeks, and stings often occur with innocent handling of beached animals. Of all the creatures of the sea wasp, Chironex fleckeri, is the most venomous. It can kill an adult in less than 15 minutes. It occurs off the east coast of Australia during summer months. The venom contains 3 components: a hemolytic component, a dermatonecrotic component, and a lethal component that paralyzes the heart. Sea wasp envenomation is said to be excruciatingly painful. Victims reflexively retreat upon being stung, and that's a telltale sign signaling alarm to lifesavers. They may also shriek and claw at the tentacles, wrapping around their limbs. In severe cases, death may occur within a minute as the person drowns. If victims do survive, the skin vesicular lesion can be seen. It has a ladder or bead-like appearance. Treatment may include emergency CPR and the administration of sheep antivenom. Even if the victim does survive, the antivenom nevertheless protects against the skin lesions that may develop and may scar an individual for life. Fluids and vasopressor support may be required, such as the calcium antagonist verapamil or perhaps adenosine, to treat the cardiac arrhythmias. This illustrates the type of necrotic lesion that could develop. The scarring is frequently permanent. The use of antivenom reduces the extent of the lesions. In dealing with these creatures as a rescuer or healthcare professional, one should remember to wear double gloves and avoid being stung oneself. Thereafter, the approach to removing the cause is generic, rinsing with vinegar, seawater, or triple-strength saline, removing gross tentacles with forceps, and then using acetic acid to remove any residual tentacles so as not to discharge them. Shaving off nematocysts may also be helpful after destroying them. Antihistamines, analgesics, and tetanus toxoid may be indicated. The possible complications of severe envenomations may include immediate death and anaphylaxis. Hypertension may require fluid resuscitation. There are some creatures that cause hypertensive episodes, such as irukandji, and these may justify alpha-adrenergic blockade. Hemolysis may precipitate renal failure. Antivenoms are useful in attenuating the side effects of the chironec stings, but that may also bring its own complications. The next category is the stickers. Stickers include vertebrates and invertebrate animals. We'll discuss them in greater detail shortly. There are approximately 1,000 fish species that pose a potential threat of envenomation to humans. The best known culprits are the scorpion fish family. In order of increasing toxicity, they are the torois family or lionfish, which are very popular with marine aquarists, scorpionfish, commonly seen on shallow reefs, and the notorious stonefish, which may even survive out of water for periods of time and is the most venomous fish known to man. Handling these fish underwater is unwise. Scorpionfish have various spines containing a heat labile myotoxin that affects both skeletal and cardiac muscle. Upon injection, there is immediate pain with blanching and cyanosis of the area. J.L.B. Smith, a famous ichthyologist who also described the coelacanth, describes his own accidental envenomation by a stonefish in great detail. He describes the pain as being so intense that he recalls little about it, and in fact about the first hour. Various remedies were tried, as he was eventually about to lose consciousness. Then his wife, Margaret, dunked his hand in a bucket of warm water with almost instant relief. Nevertheless, he developed extensive blistering and loss of skin and was unable to use his right thumb for the best part of 2 years due to residual stiffness, and had trouble with it for the remainder of his life. For scorpionfish, the treatment includes extracting spines, removing any visible pieces of sheath, and then applying hot water immersion, which is very effective. Local anesthetic injected directly into the wound may also be helpful, and has the additional benefit of being absorbed into the lymphatic system and thereby numbing the lymph glands as well. One has to be careful not to numb the hand and subsequently boil it accidentally in water that is too hot. Intermittent exposure to 45 degrees centigrade water, which is then the equivalent of 113 degrees Fahrenheit, is optimal. X-rays are usually required to exclude retained remnants that will perpetuate pain and infection until they are removed. Wounds should be adequately irrigated, debrided, and explored for remnants. Wounds should not be sutured, and prophylactic antibiotics and tetox should be administered. The most dangerous period following envenomation is the first 4 hours, at which time the victim should be very carefully observed. There is an antivenom available in Australia, and it's quite effective. 1 milliliter of antivenom neutralizes 10 milligrams of venom, which is basically the contents of one spine. Hyoscine and emmetine injected into the wound also appear to be effective, possibly due to their low pH. Stingrays are beautiful and docile creatures. They have 1 to 4 spines on the tail that may be used in self-defense. The spines are covered with a thin skin that is broken when penetrating the victim's skin, allowing the venom to be injected along the grooves in the spine. The spines themselves result in punctures, lacerations, or the combination of these. Deaths have been reported in Australia when large stingrays have punctured the pericardium, pleura, or peritoneum. Steve Irvin has been one of the most recent victims. This illustrates the most common way in which envenomation occurs. This video clip shows it in action. The spasmodic action by the tail could certainly have resulted in a serious envenomation in this case. Here are obvious victims of stingray attacks. The barbs are still in situ. What is important, however, is to always use X-rays or ultrasound to find any retained remnants. These should be removed to resolve the problems with ongoing pain, infection, and delayed wound healing. What is important, however, is to always X-ray these injuries to identify any retained remnants. These should be removed to resolve the problems of ongoing pain, infection, and delayed wound healing. It is sometimes helpful to provide a metal marker to outline the actual puncture site, as some of the barbs may not be readily detectable. Stingray venom is also heat labile and cardiotoxic. The wounds are very painful, lead to hemorrhage and necrosis. Cardiac dysrhythmias are the most serious side effect. Treatment follows the standard guidelines, with heat in the form of hot packs or water being the most effective. Sea snakes. There are some 52 species of sea snakes, all of which are venomous. They are rarely sighted, and yet these are the most abundant reptiles on Earth. They are common in the Pacific and Indian Oceans, but most bites, fortunately, do not result in envenomation. The venom is delivered through 2 to 4 hollow fangs by venom glands. The venom contains 3 neurotoxins and myotoxin. It blocks neuromuscular transmission, and the potency is greater than that of terrestrial snakes. Initially, there is no pain or reaction. Then, neurological symptoms start setting in after about 2 to 3 hours. Slurred speech may be followed by an ascending paralysis, affecting the cranial nerves in reverse order, ending up with respiratory depression and coma. Muscle breakdown and coagulopathy may precipitate renal failure. Supportive care is vital as paralysis sets in, and antivenom, if it is available, is best delivered within 8 hours of the bite, as soon as the earliest symptoms indicate a true envenomation. On the invertebrate side, it's the echinoderms that are the most important to consider. Echinoderms include starfish, sea urchins, and sea cucumbers. The crown-of-thorn starfish is perhaps the most notorious of these. These animals are responsible for the mass destruction of coral in the barrier reef. A recent attempt at eliminating the animals resulted in one of the best published series of envenomations. In the innocent volunteers, it was found that it took 15 to 20 spines to produce serious side effects other than transient pain and bleeding, which was common. Serious envenomations resulted in muscle aches, paralysis, paresthesia, and gastrointestinal symptoms. Delayed foreign body reactions also could occur. Treatment is largely heat, either in the form of hot water or hot packs, local anesthetic, debridement and exploration with X-ray, and antibiotics and tetanus toxoid, when these should be considered. The runner-up as far as toxicity is concerned is the long-spined sea urchin. The hollow spines contain venom glands, and the spines are covered by venomous mucus and thin epidermal layers of skin. Venom is introduced by penetrating the skin of the victim or breaking the spines, releasing its hollow contents. The result is intense pain, swelling, and redness. If joints are penetrated, a serious synovitis or tendon sheath inflammation may result. It's important to recognize that spines may release their surface pigment without the actual spine remaining behind, like a form of tattooing. Treatment is then rather straightforward. Remove all the visible spines, use hot water for pain, X-ray or ultrasound any potential residual spine remnants, and if they're near or in a joint, explore the wound and remove them. Consider the use of antibiotics if there's evidence of infection and if surgery was required. These two images show the range of possibilities. On the left is the hand of a child that has been playing in a tidal pool, inadvertently touched a sea urchin, and withdrew the hand, with the marks being due to pigment. There were no actual spines left in tissue. On the right is an adult who developed deep penetration of spines into the metacarpal joint space, necessitating surgical removal. On the low range of risk is the short-spined sea urchin that produces the attractive shells that most people have seen in tidal pools. They populate the intertidal zone in colder waters and are often a hazard to shore entry. They are an indication of healthy coastlines. The spines are not venomous, but they are a foreign body and may cause infection or delayed foreign body reaction. Experience has led us to recommend that if more than 10 spines are embedded, it is wise to remove them to avoid granulomas. Application of vinegar may help dissolve the spines, and steroids may help reducing the inflammation. X-ray and ultrasound are useful to locate spines and to determine whether there's need for removal. Sea cucumbers are a delicacy in some parts of the world. However, some species contain a venom that is introduced by the sea cucumber inverting its intestines upon an unsuspecting victim, usually when stepping on it. Painful erythematous lesions may result, but the greatest danger is if it enters the eye, which can actually lead to corneal blindness. The treatment is similar to other salintrate envenomations. In the case of ocular envenomation, heat is only of limited value, and cycloplegia and cortisone must be recommended. Sponges have been used for many centuries as bathroom accessories, but only once the resident animal has vacated its skeleton. While it's there, sponges contain foreign material that may be irritating to the skin, such as silica spicules that may cause penetration of the skin with edema and vesicular lesions. Treatment includes removing the spicules with adhesive tape, dissolving them with vinegar, and using antihistamines and cortisone to limit reactions also improves the outcomes. Antibiotics and tetanus toxoid may be indicated. Mollusks may also contribute to some of the sticking invertebrates. Of 45,000 species of mollusks, only the cone shells and octopus present a danger to humans. Cone shells are sought after by shell collectors as they are quite beautiful and valuable. However, the venomous tooth of a cone shell is able to deliver a lethal paralytic muscle relaxant similar to curare. There is nowhere to hold the shell to avoid envenomation. Results of envenomation are relatively predictable with pain, cardiac and respiratory depression following. Bleeding abnormalities and even death may occur. Treatment includes the conventional ABCs, hot water, observation, supportive therapy, and treatment for coagulopathy. This illustrates the predatory nature of the cone shell. The yellow object is the venomous radula or tooth penetrating the unsuspecting fish. The fish is captured and ingested. The next creature to consider is the beautiful blue-ringed octopus. The salivary glands acquire a venom called maculotoxin that is identical to tetraodotoxin. It blocks sodium channel transport, causing neuromuscular paralysis. The bite is numb initially, and paralysis sets in within about 10 minutes. Cranial nerve palsies and respiratory and cardiac depression develop. Unfortunately, this is one of the few venoms that is heat stable. All that can be offered is supportive therapy, atropine, acetylcholine esterase inhibitors, and life support. Consciousness is preserved. Scrapers. Briefly, scrapers include all marine creatures that have an abrasive surface, allowing colonizing bacteria to enter the skin upon inflicting an injury. Various fish have non-venomous barbs and spines that would also introduce pathogens. The treatment is therefore really at limiting the infection, including cleaning the wound and the use of prophylactic antibiotics and tetanus toxoid. Shockers. Electric rays are slow and ineffective swimmers and are usually submerged in mud or sand in shallow depths where they are found throughout the year. On both sides of the spinal column are two kidney-shaped electric generators that can deliver an electrical discharge between 8 and 220 volts. The current is passed from the electrical negative underside to the positive top side of the fish. The electrical discharge is immediate upon touching the animal, although physical contact is not required to be shocked, and successive shocks can be delivered, although with lessening intensity. Then there follows a latent period in which the fish regains its electrical potential. Shocks are rarely serious, but may lead to unconsciousness and therefore drowning. Bearing in mind the various potential injuries that humans can sustain, what should be on a first aid kit? Well, in order of importance, it should include epinephrine, antihistamines, cortisone, antibiotics, anti-inflammatories, topical cortisone cream, EMLA, and Neosporin, not to forget tetanus toxoid. Other items include copious amounts of vinegar, shaving cream and razors, forceps, adhesive tapes, hot packs, hot water, disposable gloves, steri-strips, dermabond and a skin staple gun, bearing in mind that there are many wounds that should not be sutured, although injuries to the face are usually okay due to good blood supply. I would also add injectable local anesthetic. Although not available in the United States or South Africa, sea wasp, sea snake and stonefish antivenom may be available. If you are diving in areas where these creatures may be found, it may be wise to check local stocks if they are available. Finally, we'll be brief in considering the problems related to the ingestion of seafood. There is one human death for every 1 million tons of seafood we eat. The most important causes of mortality are paralytic shellfish poisoning, ciguatera, and tetraodotoxin, together with infections. We will consider the first three. The toxins contained in seafood are acquired in different ways. Most accumulate due to the animal ingesting toxic plankton, which is mostly harmless to the fish, but very harmful to the biped predator. Pufferfish have been thought to be inherently poisonous, although it has now been found that cultured pufferfish are not, which suggests that they also acquire toxicity. Finally, the decomposition of certain fish may produce toxicity. Poisonous plankton is the source of the majority of seafood poisons. Hazardous algae blooms are the result of surface water being displaced by offshore winds, allowing upwelling of deeper, colder water containing plankton spores and oxygen. Upon arrival in the well-illuminated surface zones, there's a plankton bloom. Due to the massive production of biomass under these ideal conditions, oxygen supplies are rapidly exhausted, resulting in death of the organisms and the release of their toxins. These are then filtered through various shellfish, rendering them toxic, and this may continue for as long as 6 months. This map shows the distribution of hazardous algae blooms in the United States, and one can note that the paralytic shellfish poisoning is common in the colder waters of Maine, California, and Alaska, whereas ciguatera poisoning is a tropical disease. Paralytic shellfish poisoning. This is an example of red tide, which leads to paralytic shellfish poisoning. There are various forms of shellfish poisoning, but we'll focus on this one in particular. Hazardous algae blooms with Gynelux catenella produce saxitoxin, which is concentrated in the resident shellfish, and 2 to 3 mussels may contain enough poison to kill an adult. Gary Powers, the U-2 pilot that was downed by the Russians in the 1960s, had with him a suicide vial with saxitoxin. As you might expect, the poison is analogous to tetraodotoxin and inhibits the sodium-potassium pump in nervous tissue. Symptoms may occur within 20 minutes to several hours depending on the combination of food and alcohol. The first evidence is perioral paresthesia with subsequent weakness and paralysis. Treatment is supportive, and note that the fixed dilated pupils may be the result of the poison rather than actual brain death. Ciguatera poisoning. This form of poisoning is also due to ingestion of poisonous plankton, with the interesting phenomena of concentrating up the food chain from herbivorous to carnivorous fish. The name is derived from a poisonous marine snail first encountered by the Spanish settlers in the Caribbean. Plankton ingested with coral eventually becomes stored in large carnivorous fish. There appears to be an association with the destruction of marine life and coral reefs precipitating ciguatera epidemics. The British occupation of Mauritius failed in 1748 due to the destruction of the reefs in preparation for landing. Similar events have occurred in response to natural or unnatural destruction of coral reefs. Ciguatoxin is harmless to fish and concentrates up the food chain, with the viscera being the most poisonous. There are 3 major toxins, including ciguatoxin, mycotoxin, and scarietoxin. Ciguatoxin blocks sodium channels in the open position, resulting in continuous depolarization of the nerve cell. Demyelination of the spinal cord and brain may lead to long-term effects. Cholinergic effects result in bradycardia and hypotension. Symptom onset is typically fast, within 15 minutes to 4 hours, and there are 4 symptom complexes that may occur in different combinations and severities. The gastrointestinal side effects are usually associated with lower levels of poisoning, especially with ingestion of lower concentrations of herbivorous fish. The cardiovascular and neurological symptoms are more common with the ingestion of large carnivorous fish. Respiratory failure may result, and death occurs in about 1% of cases. Reversal of the sensation of hot or cold is one of the classic signs of ciguatera poisoning. Mycotoxin causes norepinephrine release, whereas scarietoxin has the additional effect of inducing vertigo. There is unfortunately no reliable way to determine if a fish is toxic or not. Smell, color, and taste are normal. Folklore suggests changes in silver coins or coconut if cooked with the fish, but these have no scientific basis for reliability. Small fish, of course, are safer, and the locals are a valuable resource on the safety of certain species of fish. Japan has produced a monoclonal antibody test, and one that has been released in the US by Oceanet, but the cost is approximately $30 for 5 tests, and it takes about 45 minutes, so it's not really taken off. There's, of course, the cat or granny test, because kittens are very sensitive to ciguatoxin, and family elders may be a more traditional substitute. Treatment obviously includes ABCs. Stomach emptying is indicated up to 6 hours after ingestion in conscious persons, and intubation with gastric lavage for incapacitated individuals. Activated charcoal may be of value. Atropine may be valuable for the cholinergic side effects, and calcium gluconate for the neuromuscular dysfunction. Mannitol has proven to be one of the best and most effective remedies in acute cases. 250 milliliters of a 20% solution with a maximum of 1 gram per kilogram appears effective. Mannitol serves as a sodium channel antagonist and provides immediate relief of all symptoms. Relapses may occur and must be monitored. The diuretic effect of mannitol may also aggravate hypovolemia, and this should be managed. Symptoms of ciguatera poisoning may persist for years after the major recovery has occurred. Similar fish should be avoided forever. Fish meal fed to farm animals may result in paradoxical sensitivity to poultry and pork. Alcohol, or in fact any nervous system stimulant or depressant, may elicit symptoms. Insomnia and depression may follow poisoning and may need therapy. Pufferfish, or tetraodons, meaning 4 teeth, offer one of the most profound forms of poisoning known to man. Chinese and Egyptians already recognized this form of poisoning, and the Bible advises against ingesting scaleless fish. Wade Davis published an autobiography called The Serpent and the Rainbow, which was eventually captured in a major film and depicted the effects of tetraodotoxin and the origin of zombies in Haiti. Tetraodotoxin is soluble in water, heat-stable, serves as a cholinesterase, and blocks the sodium-potassium pump, depressing neuromuscular function and the sympathetic nervous system. The symptom onset may be within 5 minutes, with numbness, paresthesia of the lips and tongue, gastrointestinal symptoms of nausea, vomiting, diarrhea, and pain, respiratory symptoms of paresthesia, respiratory muscle paralysis, and eventual inhibition of the respiratory center with a mortality of 50%. Collapse of the cardiovascular system may lead to hypertension, whereas the central nervous system may also be affected with twitching, leading to ultimate muscular paralysis, bulbar weakness, and fixed dilated pupils. Therapy is supportive. Anticholinesterase such as neostigmine may be considered, atropine for the bradycardia, and sedation during ventilation, as consciousness is not affected. Scombroid poisoning. Scombroid poisoning involves histidine in tissue, which is converted through degradation by decomposition and bacteria to saurine, which is a histamine-like substance. The fish has a sharp, bitter or peppery taste. The type of fish involved is actually not salmon, and rather includes tuna, mackerel, jack, bonito, albacore, and maybe mai, bluefish and anchovies. Symptom onset is typically within 10 minutes to an hour and includes severe headache, arrhythmias, shock with hypotension, a severe rash over the whole body, burning, urticaria, bronchospasm, and possible respiratory distress. Essentially, it's analogous to an allergic reaction, except it would be epidemic in that many people are affected. The whole body wheals are rather characteristic. The symptoms usually, fortunately, only last a few hours, and death is unlikely. The treatment focuses on bronchospasm with beta agonists and steroid inhalers, antihistamine, intravenous cortisone, and supportive therapy. There are several other causes of poisoning. They include clupioid or herring poisoning, which is rapidly fatal and similar to ciguatera poisoning. There's also crustacean, gastropod, gempelid, hallucinatory fish poisoning, ichthyohemolytic, ichthyohepatotoxic, and ichthyototoxic poisoning, mercury poisoning, shark and ray poisoning, and turtle and tortoise poisoning. How to avoid injuries. Most importantly, to avoid hazardous marine life injuries, buoyancy control skills should be practiced. One should be aware of one's surroundings, look up and around when ascending, shuffle feet when entering water, and wear thick-soled boots and fins. One should avoid carrying speared fish and streamline one's body and equipment so as not to irritate one's undersea so as to avoid irritating fish and creatures underwater. One should also know what hazardous marine life may inhabit an area, to pack a first aid kit and oxygen unit able to deal with emergencies that may arise, wear appropriate exposure protection, even in warm waters, and be passive when interacting with marine life. One should avoid using the reef to stabilize oneself, avoid picking up shells, avoid eating raw fish, and training may be had in the form of the Divers Alert Network First Aid for Hazardous Marine Life Injuries course. One needs to understand the risks and be wise about one's choices. Similarly, diving itself is a wonderful sport. Only 2% of injuries involve hazardous marine life, and mostly these are relatively trivial. Diving remains one of the most marvelous sports we are able to enjoy.